In our morning rounds, a new warning about the threat of a stroke. This morning, the American Heart Association released its first ever guidelines just for women. They're aimed at fighting risk factors men don't have. Dr. Carolyn Brockington is the director of the Stroke Center at Mount Sinai, St. Luke's Roosevelt Hospital here in New York. Good morning, doctor. Good to see you. So more women than men die from stroke. What makes women more vulnerable?
Well, you know, there are risk factors that both men and women have. We all know high blood pressure or hypertension, diabetes, etc. But women have unique risk factors for stroke. That's where these guidelines are speaking to, which really centers around hormone, pregnancy-related issues, migraine with aura, for instance. So
Aura, what do you mean?
Yeah,
migraine?
So migraine with aura, migraine, everybody knows it's a specific type of headache, but migraine with aura means the aura is sort of the sensation you can have before getting the headache. So some people have lights that flash and they see the light flashing. Some people feel nauseated. Some people feel very dizzy or anxious before actually developing the headache. And those type of migraines have an increased risk of stroke. And so part of the guidelines are saying that women who have migraines or these specific type of migraines should be evaluated and also should stop smoking, right? We know that smoking's bad, all right?
Yes.
But in terms of the brain, it's really bad because smoking can cause the blood to become thicker. And when the blood becomes thicker, clots can develop. Clots go to the brain, and that's what causes a stroke.
It is one of my biggest fears. You know, the minute I feel something, I think, is it a stroke? Can it be prevented?
Strokes can be prevented. I mean, the good news is that you really just have to know your risk factors and modify them appropriately. So that's why this is very exciting, these guidelines, because it empowers women to know what risk factors they may have. And
Prevent it how, though?
Well, let's say that you decide that you want to use oral contraceptive therapy. It really is the time then to talk to your doctor about whether you have some of the risk factors, high blood pressure being one of them, because maybe it's not the best choice. Now you're using oral contraceptives with high blood pressure, or if you have a family history of blood clotting problems, it becomes a time where you need to discuss with your doctors about maybe what your risk is in regards to that.
And
so
if you think
important.
you are having a stroke, the most important thing you can do is get in touch with a doctor.
Go to the emergency room.
Yeah.
We say in stroke, time is brain, because we know how the brain works, right? Left side of the brain takes care of right side of the body and vice versa. So the minute the brain isn't getting enough blood flow, that part of the brain can be injured irreversibly and cause devastating symptoms. So it's not the time everybody wants to go on Google and sort of figure out their own symptoms. This is not the time to do that.
Yeah.
You've got to go right away, because we do have effective treatments that we can give people to reduce their disabilities from stroke.
Thank you, Dr. Brockington. Good to have you here.
Thank you, Dr.